Measuring how well someone can perform a task can be difficult to do. Sometimes the best way to understand how well someone is doing is to ask them. The research community and the FDA recognize that patient reports can be very valuable in understanding how well therapy is working. The FDA encourages the use of patient-reported outcomes, or PROs, in clinical trials. PROs are surveys or questionnaires that report the status of a patient's health condition directly from the patient without interpretation of the patient's response by a clinician or anyone else. Patients are the pros when it comes to reporting on their own experiences. PROs typically include information about health-related quality of life, symptoms, function, satisfaction with care or symptoms, adherence to prescribed medications or other therapy, and perceived value of treatment. To identify the symptoms that are most important to children and adults with Friedreich's ataxia, Chad Heatwell, a clinician researcher at the University of Rochester Medical Center with funding from FARA, conducted caregiver and patient interviews with parents of young children, and adults with Friedreich's ataxia. The Heatwell research team then used the information from the interviews to identify relevant changes in several areas of Friedreich's ataxia patient health: physical, social, emotional health, and additional FA symptoms. Using established methods, the themes identified in the interviews were used to generate two patient-reported outcome measures: the Friedreich's ataxia health indices, or FA-HI, for patients 11 years and older, and the Friedreich's ataxia caregiver reported health index, or FA-CR-HI, for parents and caregivers of individuals with FA ages 5 to 21 years. Once the PROs were developed, the next step was to obtain feedback from FA patients and researchers to further optimize the instruments and to test for validity and reliability. So what does the FA-HI measure? Mobility, ambulation, coordination, arm and hand function, fatigue, sleep and daytime sleepiness, social performance, activity participation, emotional health, communication, vision, heart health, pain, and overall disease burden, and more. More than 200 individuals with FA and caregivers have contributed to the development, testing, and validation. Development of FA-specific PROs bring your voice to the forefront of clinical trials. FARA has recently funded an additional study to evaluate the sensitivity of these PROs to capture change over time in FA, and to identify potentially modifiable factors that are associated with a more rapid progression of disease. This study, the longitudinal endpoint optimization, to provide an assessment of relevant drugs in Friedreich's ataxia, or LEOPARD FA, is getting started. These new PROs can be administered electronically via tablet or phone, no pencil and paper. FA-HI and FA-CR-HI provide researchers and companies developing therapeutics for FA with valuable tools that can be used in pediatric and adult FA clinical trials to clearly demonstrate if a therapeutic is affecting the underlying symptoms and disease trajectory of FA. Our thanks to all the affairs and FA caregivers who participated in this valuable research.
The project we just learned about is One Seed, One Tool, funded by your donations, championed by your engagement and your direct participation in FA research that is necessary to plant, tend, and nourish our garden of therapeutics. Thank you, FA community, for bringing us closer to treatments.